Welcome to Planetary Health First, Mars Next. We are live at VIVE and we have Priyansh here. He's the founder of World Youth Heart Federation. You're probably asking almost like, what the heck is Planetary Health First, Mars Next, and what is his organization? Well, he just won this award. You want to tell us about this award?
Yes, for sure. Thank you so much for the introduction and the opportunity to be here. I'm just glad to, have this opportunity. So the award is, we won the award for the most promising case study globally by health in the VIVE this year. And would just love to jump in and talk more about the case study that we won the award for.
That's awesome. When was that award won?
Just yesterday.
Oh wow!
Yeah.
Wow, that's awesome. Will it be? Was it officially announced yet here?
Yeah.
Cool.
Yeah, it was announced in the impact stage yesterday at around 10:30 a.m. Yeah, and we won a badge. And so interestingly, this is on Tequity, which is technology for health equity. And this is, this came up by the Tequity Coalition by Health. And this is the first year they're having this award, and they're planning to do it for several more years, coming out. So we are essentially the pioneers. So it's quite interesting.
How in the world did you find out about this to put yourself out there to even apply?
That's an interesting question. So I've honestly been following the work by Health for the past couple of years, because we've been working in the space of digital health for these last 2 years, and Health and Chime are two of the biggest organizations out there. And we had several of our collaborators and partners be here, present here, rather, in the previous years. I think it was in Chicago. The Health last year was in Chicago, is where we had a lot of partners go.
That's awesome. So tell me a little bit about yourself. You're doing this. You started this in India, but the vision and mission is not just India; it's globally. Mm-hmm. And you shared with me a little bit. You're a physician. You're a doctor trained in India, and now you're doing a fellowship in Harvard. So just tell us more about you.
Yeah, for sure. So I finished my med school back in India in 22. And after that, I came here. I'm currently working as a postdoctoral research fellow at Bethesda Deaconess Medical Center at Howard in the Department of Cardiology, where I'm focused more on metabolomics and proteomics. And since the past 4 years, since I founded the World Youth Heart Federation, it was during the pandemic we got an opportunity to actually bring together all of our colleagues who were very passionate about this cause but never found the right time. So that's when we got together and started this organization. The goal of our organization is to improve cardiovascular health of the society by promoting intersectoral collaboration, because we feel it's not only the physicians, but it's everyone who's out there who should feel responsible for our own heart health, because it's something which is extremely common. Majority, like almost 1/3 of the people globally have heart diseases or end up dying by one. So it's a huge problem, and it's led by the youth under the age of 35 years. And we've got 5 working areas, which interestingly go with the acronym of HEART. So there's health education, entrepreneurship, advocacy, research, and technology. And over the past 4 years, we've ended up impacting almost over 1 million people.
Wow. Well, there's a reason why you won that award. I mean, you have numbers, data. You're doing some real stuff.
Yeah.
That's awesome. Really, that's super cool. So, you've impacted 1 million people. How is it the involvement with your organization? Like, is it membership driven? Like, tell me about the working of your nonprofit.
For sure. So we essentially started off, since I had been working at several other student-led organizations, medical student-led organizations. So we already had a network of these students. So we currently have over 25,000 volunteers in India, and all of these volunteers are, they can sign up for an event if they find that's interesting. They can sign up for a project in all of the 5 working areas that I mentioned earlier. And Project Cardiogram, for which we won the case study award, was a flagship project, where cardio is heart and gram means village. So there were several parts of it, and all of those volunteers, they either participated, let's say, in the baseline assessment part of the project, they could have participated at a screening camp. So we've got multiple opportunities, and we're not limiting it to people in the medical field. We've got lawyers, we've got chartered accountants, we've got people who are in business. But there are several who reached out to us saying that they had a personal family story that maybe their father or their grandparent died of a heart disease. And that's what drives them.
Yeah, no, healthcare is personal. I can share that myself. My mother's 85, my father's 91. He's currently dying. He's in hospice. He has dementia and heart failure. But he's lived an amazing life, and so it's honoring him. But through this journey, what you're doing matters that much more to me. And then the fact that it's global, and then so I love the fact that you've been able to enlist 25,000 volunteers. Geez, like, and what is, like, how in the world are you doing this? Like Facebook, Instagram, I'm like, what are you doing to get those channels of people coming?
So that's a very interesting question. Just before jumping into that, I just wanted to say that more power to you for your dad who has heart failure and dementia. That's very difficult to go through. So just more power to you for that. And jumping into the media channels, so a couple of years ago, I won a Johnson & Johnson One Young World Scholarship, wherein 6 people across the world were selected to be a part of this event called One Young World, when youth leaders come about. And that's where we started working on this digital platform to help the volunteers interact with the website, with the organization's web platform directly. So that is something which we're going to launch in a couple of months. But up till now, we've been using large WhatsApp groups and WhatsApp channels. We've divided countries in Northeast, Southwest to make things easier and have a better catch. And any questions that people might have, they could just reach out to the leaders of that area.
And so I imagine WhatsApp, like, for those that don't know, and I probably don't know, I'm just guessing, WhatsApp with India, the mobile first is a big element there. Is that correct? There's a lot of even though there's like some challenges in the development of the nation, mobile is first there, and so it's WhatsApp is highly accessible. Is that correct?
100%.
Okay.
Yes.
So it sounds like you were really wise and smart to use the communication channels that people are already doing. And then I'm also thinking, when you said different regions, did you hyper focus, get some active ambassadors or something? Tell me about that.
Yes, so this is something ingrained in our structure. So we've got a vice president for network who helps with the capacity building of the entire country. And now, as we're soon launching our global space, we would also have regional directors for all the 7 WHO regions. So under this national director for capacity building, vice president for capacity building, we have regional director Northeast Southwest, and they are essentially the ambassadors. And it's interesting that we need to divide the regions because every region is unique. In India, every state, it's like one whole country based on the population and the diversity. So it's very important to focus on different areas with a different approach and someone more local.
So what little I know, I don't know, I want to go to India. I know also the little I know from just learning.
Yeah.
So many different regions, especially with tech. Like certain regions are super tech with this or tech on this area. But man, like there's so many different languages, dialects, culture, tell me a little bit about that dynamic and how you overcome those barriers.
100%. And so we strongly preach something called local champions. So for all of these projects, when we go on ground and when the rubber hits the road is when we actually get to understand what's happening on ground. And why I use the term local champions, because it doesn't have to be a doctor. It has to be someone from the community who's driven enough, who has the knowledge of the community, right from which road connects where to who lives where, and what people are interested in. So these projects, we try that these implementation science projects are led by these local champions, so they're fluent in the language, they're fluent with the community as a whole. And as an organization, what the volunteers do is they go and train these local champions, either in Hindi, which is the national language, or these volunteers also are from the same community, so they would also know the local language. So if required, the transmission at a national level happens in English, which every volunteer usually knows, and these volunteers then further help translating it and making it more relevant to the local community, because some places might have, let's say, more of hypertension and pregnancy as a problem, whereas some places might have a problem of heart attacks and low access, which was the case in our state. Yeah.
Cool. And I'm just blown away. When I first met you, it was just amazing. I was introduced by my dear friend Gil Bash, and that was yesterday in our, whatever this little thing is. I call it the VIVE Hive, or however this little community where all of us are here in the podcasting little area. And he introduced me. You started sharing everything, and it was just what I'm just blown away. I'm just trying to understand it, right? And so it's like so many layers of what you're doing. Yeah. And you then again kind of helped me with the 30% under 35. Because when I think of heart disease, heart failure, I'm always thinking like Medicare Advantage, older adults. That just blows me away. So that to me was like helping me understand, because I was like, what is this guy doing? Heart disease, youth, and I get it now.
Yeah.
And that's just what's fascinating.
So something very interesting to share, that mostly all of us, and even the Medicare, Medicaid, the healthcare system right now is disease focused. So, as soon as someone gets a heart attack, or someone, let's say, has high cholesterol or gets an artery blocked in one of their scans, that's when they enter the healthcare system. But everything starts way beyond that, right? From when you're 14 or 15 years old, you need to make sure that your diet, your sleeping habits, your physical activity is right. So this is something, so as I was mentioning earlier, the next year is the UNGA, and the focus area would be non-communicable diseases, when cardiovascular health is a major focus. In that, in last year's Director General, the WHO Director General's report, he kept physical activity as one of the major points, and we still don't have analysis on physical activity in school-going children. We don't have robust programs which at a policy level.
Yeah.
So that is something that we're working on, and we feel that if we're able to make the young individuals feel responsible for their health at a young age, they're definitely going to have a much better life at a later time, hopefully lesser heart diseases.
Yeah, no, this is great. So, and this is world. So tell me where you are. You're in India, and you shared with me a little bit about Mexico. Tell me the other countries. Tell me what next and where you're going.
For sure. Thank you for asking that. So we have been established in India for, it'll be 4 years this July, and we spent a good time in this country to test the organizational structure, our different outreach methods, our activities, to have a solid standing. And now that we have a solid standing, we're expanding globally. A platform that I mentioned earlier, which would allow volunteers to directly interact with the organization. So we're looking at, in the Americas, North and South, we're looking at Mexico, we're looking at America, Canada, also Peru, and then in Africa, we're looking at Sudan, Nigeria, Egypt, Kenya, and in Europe, we're looking at UK, Bosnia, Herzegovina, and Italy. And in South Asia, we have India, Bangladesh, Pakistan, and in Southeast Asia, and Australia as well. So one of our directors of research is going to be from Australia. So, and the best part would be that we'd be establishing national chapters in all of these countries, so that people can start off with local and national projects which are more relevant to their people, again in their local language, in relevance to what's the on-ground reality.
Yeah.
Because
What is the biggest thing you need right now to make this vision? I mean, you have a huge vision. I mean, even Mark Zuckerberg, when he started Facebook, he was just whether the girl was hot or not in his dorm room. I mean, you're like in a country already and 4 years out. I mean, this is just incredible.
Thank you so much. So I think the biggest help we need right now is a sustainable source of funding for the activities that we do. Because at this time, all of us are working on a voluntary basis, and it's just mainly the passion that's driving us to do everything. So one of the biggest things we're looking for is a voluntary funding for our activities. And the second thing is more support by youth advocacy lobbies. We're already a part of several, but I think that's something which is always required to put the word out and have youth a seat at the table.
And when you mean that, like advocacy, like legislative, going to the different legislative groups to advocate for changing the laws, for getting that sort of aspect embedded in their.
So I feel it's like an entire cycle. If you want to make a holistic change, a change in the entire community, you have to start connecting the dots backwards, which means you have to start from policy. You have to see what policies are in place which are being implemented actively. Based on that, you have to identify the gaps which are there in terms of research, which is what we work on extensively. And with identifying those gaps, you don't stop there. You work on implementing and trying to solve those gaps with the activities that we do on ground, and then complete the loop back by suggesting that, hey, this is something that we tried, and this is cost effective, this is accessible, and this has got good outcomes. This is something that we should implement. So that's an entire circle that we like to go through. So what I meant by advocacy could be anyone in the nonprofit space or anyone in even the legislative or the government space could be great supporters.
Yeah, so you are a nonprofit. You shared with me that earlier. And so do you have board members? What are you trying to do to structure your governance, your guidance as you build this organization out?
Yes, for sure. So we have, so our structure is like, we have an executive board, which is responsible for majority of the administrative aspects, if I could call so. And then we've got a board of national directors, so we've got a national director, and soon we'll have a global director for each of the 5 working committees I mentioned earlier. So this is a team that leads the day-to-day activities, and then we've got mentors who are mid-stage of their career, who can help and give in some more time for individual activities which align with their focus areas. And then we've got a board of advisors. One of our advisors is Professor Srinath Reddy, who's a founder of Public Health Foundation of India and was the previous president of the World Heart Federation, and an amazing fellow who's helped us immensely. So, and the board of advisor is someone who's at a higher level, can have shorter, maybe once a year or twice a year meetings, and guide us more in the direction that we're heading, more than the day-to-day things.
Well, so with funding, how are you envisioning, like, as your conversations you've had to kind of create this sustainability? What are you looking at? Like, what kind of model? I understand you're a nonprofit, but there's lots of different ways to do that.
Yeah, 100%. So currently we've been functioning on need base, and we're a registered nonprofit, a Section 8 company in India. So we have the tax exemption, so we are able to collect donations in that sense. But right now what we're mainly focused on is under technology and entrepreneurship. We're trying to launch smaller sub-projects as from the organization, which hopefully would go out in the market and serve as a regular source of revenue, a sustainable source of revenue. So that is one model. And as we know, we always have to diversify. We don't want to go big on the membership fees, because I feel it restricts a lot of motivated people who wish to help. And at a global scale, it's just, I think, extremely difficult. So not very focused on the membership fees model, but we're also looking at collaborating and partnering with bigger industry,
like corporate partners.
corporate partners
Yeah.
who
Mhm.
have a focus area, who
Mhm.
want, let's say, one of our projects that we're working on is CPR training. We're developing an AI algorithm to train anyone on
Mhm.
how to perform CPR in 15 minutes, and also give feedback on how the technique was, just using a mobile phone and a 2-liter
Wow.
bottle or a pillow,
Yeah.
which is accessible to
Yeah.
everyone,
Yeah.
everywhere.
Yeah.
So that is something that we're
Yeah.
actually planning to roll out.
Cool.
But yeah, there are several different models, and a corporate partnership would also ensure a sustainable source of funding to carry out activities which are aligned with both
Yeah.
the organizations.
Man, Priyansh, this has been so awesome. I have no idea what time it is. I have no idea. We're in the studio. I don't have my access to my watch, my clock, whatever. This has been it's been awesome. It's serendipitous that you were able to come on. So privileged, just what you're doing. So honored. Is there anything kind of coming towards the end that you would want to give a shout out? Just anything as we wrap it up?
Yes, for sure. So first of all, shout out to you and Luke for, having me on here, and I'm extremely happy for that. But I'd give the biggest shout out to our national team and to all of our volunteers who've actually made it possible. I'm just, luckily sitting here, but I'd say it's the work of our people on ground who've made the vision, possible.
Mhm.
So I'd give the biggest shout out to our national team,
Mhm.
and currently a global team which is being set up, and along with that, all of the supporters who,
Mhm.
like you and several other people in this,
Yeah.
even that we've met along the way and who've supported our vision and promoted the idea.
Cool.
Yeah.